want to welcome you all for the October Knowledge Exchange and Coffee of the Cops. This is a topic that we really can't talk about enough between Coffee of the Cops, Knowledge Exchange, or even within our community. Myself and Denise Timms actually approached me and said, "Hey, how do you want to do about like a joint thing and joint program where you can present on a pretty hot topic?" And this is kind of it. We came up where I got involved in a program, some fundraisers called Hope Over Heroin. I got to meet the director of, or the person coordinating Lake County Fight Against Heroin, asked her to, if she wanted to speak, and she put together a panel. Unfortunately, she's not here because she's sick, just like everybody else. So, on that, we still have a panel here. There's 3 people. I'll sit in the other one if you guys have any other questions for me. I'll introduce myself. I'm Officer Dane Palmer, Lakeland Police Department. Special thanks to Denise Timms back there. I was on 3rd shift. She made all the phone calls and made everything happen. First I want to introduce Janelle Unger. She is a family member of a survivor and an advocate for the outreach that we have. Dennis Anthony, he's the director of Friends Recovery and Men's Recovery Home, and Dr. Zinni from Glen Bay. They're going to do a brief introduction of themselves, and I'll show a quick video. We'll open everything up to questions. I'm sure you guys got plenty of questions as far as what's going on here in the community and all that. So I'll turn it right over to Janelle.
I'm Janelle Unger, and I'm also with Lake County Fight Against Heroin, and Amber sends her regards. She's very sick. She couldn't be here. And Lake County Fight Against Heroin is an outreach community strong program. I also have been going into the Lake County Jail for 11 years, working with inmates one-on-one, and about 83% now of the Lake County inmates, as far as the females are concerned, are heroin addicts. And then I also have a child who has been in his addiction for 13 years, and over the last 8 years, he is an active heroin addict. So I also come from the mom's side of view and point of view.
Dennis?
My name is Dennis Anthony. I'm director of an organization called Friends of Recovery. It's in Northeast Ohio, Lake County. We do a variety of things. One of the biggest things that we're in the process of doing is establishing recovery homes in Lake County. I currently have one, a men's home in Willoughby. I'm about to open a women's home. We're going to do 6 of them. 3 men, 3 women, and last of our women's homes will incorporate dependent children. We are a post-treatment organization. We come alongside those that have finished a formal treatment program, have remained sober for 30 days, a minimum of 30 days, and then once they go through the interview process, they have the opportunity to come in and live with us. It's a recovery home. It's not a sober house. It's not halfway, 3/4. It's not transitional. It's not flop. It's not any of those. It's a recovery house. I'm in the process of being state certified. We'll be a state certified level 2 recovery home, which brings the state in every 2 years, inspects us, everything from interviewing to how we handle things in the house, just everything. I too, along with Janelle, my youngest son is a recovering heroin addict. Currently lives with me. We've come full circle. He's moved back in with us, and so that's why I'm here. And thank you for the opportunity to be here.
And thank you. I am Dr. Richard Zinni. I am been working in this field for 10, 15 years. I've been working in the area at local hospitals for almost 35 years. I am co-medical director of Glen Bay. I'm on staff at Windsor Laurelwood, St. Vincent Charity, Stella Maris, Lake Hospital Systems, probably several others I can't recall right now. I make myself available to whoever is in need of help. Again, I've been working in this field for quite a long time. Because I working the part where they're coming in and they're sick or they need to be detoxed, which is what we do at Glen Bay. And of course, they have a campus there for various stages of treatment. And at Laurelwood, which I'm not there as much anymore. But I take care of them when they're the sickest, when they're the angriest, when they're the neediest, when they're the humbleness, when they're relapsing multiple times, or when it's the first time. And I try to get them through that initial phase, and that's, depending on how many comorbidities or co-occurring diseases that they may have, whether it's alcohol, heroin, benzos, cocaine, they're all on the rise. And they're all searching for that dopamine surge, which maybe some of you have heard, maybe some of you haven't. So that's, where the euphoria. And then, of course, it's not fun anymore, but then they don't know how to quit. So that's my expertise there. I do have to say I am also a recovering opiate addict. I have 12 and a half years. Being in the field, I thought I could just figure it out myself like all addicts do. It doesn't work that way. I couldn't quit. I didn't know how to quit. I didn't know how to reach out until I hit my bottom. And my bottom is extensive. We don't have a amount of time to doing that. But I thank God that I got my life back. I got my license back, and I'm able to reach out. I've always been helping people my whole life, but I don't know how to help myself. Of course, my family didn't know how to help me. And when I finally got into it, they weren't even talking to me, because that's what happens. So I get it. But I'm in it today because I care about people and I care about lives. And they mean something to me, they always have. And so that's why I reach out. So I hooked up with Amber and Janelle and Dennis, and Brittany is someone else that started with Amber a little less than a year ago. Because what I do is a small part, but it's the biggest part in the beginning. There's something else that has to be done. One of my things that I want to go forward with is start with the children. If they never put it up to their mouths, if they never inject it, if they never snort it, they never smoke it, they never chase it. No one told me that when I was growing up. I don't even know if I would have listened. But the disease of alcoholism was in my family. My uncles, they kept it a secret. We got to stop keeping heroin a secret. The stigma has to change. And that's where I hooked up with the local organizations, because when I first met them, I felt a passion in their hearts to learn. Amber, I believe herself is now recovering, but the passion that she learned and everyone else to learn from this disease to help other human beings and to reach out. I believe we're inherently capable of helping one another, but when we get burned too many times, we don't want to help anymore. It's not that we don't love them any less, it's just that we can't help them. So I just believe that what we have to do is go forward, and we have to encompass all treatment modalities as we get them through it and give them some hope, and that's what we believe in, a little bit of hope, a little bit of faith. And yes, it is when they come in, they're broken psychologically, sociologically, spiritually, mentally, financially, legally, personally, whatever it is. And at that point in time, that may be their bottom, and that's when they're the most vulnerable, and that's when they're willing to change. And when they're willing to change, we believe that we're developing an organization of individuals that have a passion to help another human being. And so that's, where I've come in to help them, and I got involved in Hope Over Heroin. We were able to do something that the previous Hope Over Heroines around the state of Ohio had never done, and I believe we were successful because we helped people get into treatment centers around, we worked all weekend. We had help from nurses and volunteers. To see the passion that came about just from volunteering to help another human being look past their insecurities and their ugliness that other people will see. And yes, those that have lost loved ones may see it in a different way, may be angry, but the guilt and the shame that comes along with it. And yes, I have also been an enabler of family members who are addicts and alcoholics. So I know what it's like on both ends. So, but if anything I can do to help, that's why I'm here today, to speak, and it's not because I like to hear myself speak. So with that, I'll turn it over.
They just asked that we show a quick, 2-3 minute video. If any of you guys even heard, at Lake County Fair this year, they actually put a program called Hope Over Heroin together. How many people went into recovery straight from that program?
35.
35 people, addicts in your community, went off to recovery after this program. To me, even if 10, even if 3, it would have been a win.
And it was straight from the event. And we actually had people coming up with suitcases. So they said that they've never been able to receive help from detox to treatment because of the way a lot of things happen. They get detox, but then it might be a week or 2 to get assessed and then get a doctor's appointment, and then the process is just long. And by that time, they've relapsed or used. So Dr. Zinni had a medical tent full of medical assistants and nurses, and it was unbelievable. If you give the community a chance to help, I promise you, they're going to show up, and they did. And we were able to secure a safe house. So if someone didn't get in treatment that night, we took care of them through the weekend, and they responded to love, they responded to compassion, and they responded to us not judging them. And only a few people have left the treatment. We don't have the exact number right now, but it's a very high success rate. And this video is a video that was put together. You'll see a little bit in the beginning, and then it switches over to our actual event, and it superseded all expectations.
If you've been walking the same old road for miles and miles, if you've been hearing the same old voice at the same old lies, if you're trying to fill the same old holes inside, there's a better life, there's a better life. If you got pain, he's a pain taker. If you feel lost, he's a way maker. If you need freedom, a savior, he's a prison shaking savior. If you got chains, he's a chain breaker. We've all searched for the light of day in the dead of night. We've all found ourselves worn out from the same old fight. And we've all run to things we know just ain't right. And there's a better life, there's a better life. If you got pain, he's a pain taker. If you feel lost, he's a way maker. If you need freedom, a savior, he's a prison shaking savior. If you got chains, oh, he's a chain breaker. If you believe it, if you receive it, if you can feel it, somebody testify. If you believe it, if you receive it, if you can feel it, somebody testify, testify. If you believe it, if you receive it, if you can feel it, somebody testify. If you got pain, he's a pain taker. If you feel lost, and he's a way maker. If you need freedom, a savior, he's a prison shaking savior. If you got chains, he's a chain breaker. Oh, if you need freedom, a savior, he's a prison shaking savior. If you got chains, oh, he's a chain breaker.
If you don't know what those red balloons were, each one of those red balloons represented a life lost to heroin. It's too many. We had 78 submissions from Lake County alone for a memorial video that you can find on Lake County Fight Against Heroin's Facebook page. They also have a website, Lake County fightagainst.heroin.org, if you want any more information or how to volunteer or become part of the organization in your community.
We'll open it up to some questions. If you guys have, just raise your hand and.
How long have you been operating? How long?
A year,
About
just a
year?
year this month, that Amber and Brittany got together and started out as writing letters to inmates and to encourage those that are struggling with addiction. And that's how all this got started, just by compassion and encouragement.
Yeah, it's just been over. I remember I did a Coffee of the Cops back in February, and an actual pastor approached me out in the parking lot and just broke down in tears. Just broke down in tears. And before he even told me what it was about, and he actually was handing out pamphlets for information on Lake County Fight Against Heroin. But he's overwhelmed with the loss, even within his church. And these are people that we always turn to that are supposed to solve all our problems. Cops, firemen, everybody else. Like Dr. Zinni said, he didn't even know how to solve his own problems. He was solving everybody else's. So, I had a question. Funding for everything between Hope Over Heroin. How did all of that come about? How was all that even paid for?
The community, the people, we did a lot of fundraising. A lot of people came out, a lot of donations, a lot of God moving to put on an event where there's 4,000 to 5,000 people. We didn't have any needs. Where there was a need, we put it out there, but it was fundraising. And we did, at the end of the Hope Over Heroin, there was a political person there, and he called us backstage and had a long talk with us. He has some insight. But he said, as of last month, statistically, we need to sit down and take a look at some things, because faith-based treatment centers has an 83% success rate, and government-funded has 8%. And he says we have to step back and take a look at some things. And so we're very encouraged that our state representatives are starting to take a look, and they're actually reaching out, and they've been very helpful in understanding what's going on. And the thing that touched me the most is he says, I'm not out here enough, I need to do better. So people are starting to wake up in positions that can help, and maybe someday funding will be available for nonprofit organizations, so that it's not just left up to fundraising and those kind of efforts.
And Dennis, what about the recovery homes?
Private donations.
Private donations?
Private donations is how we operate.
Is this under the 501c?
Yes.
Yes.
Was that tough to do? To get going?
No, it's not. You have to be persistent, obviously, and
Do you have to have a representative? Do you have to have somebody helping you
no,
organize the paperwork?
no. Just about anybody can do it. You just it's a journey you'll go on, but there's help all along the way. It's not quick. It's not a quick.
How would somebody get started? Do they just do it on, is that what you're asking too? Maybe even the starting point of how to apply for one?
You do need some legal help setting the paperwork up.
Yeah.
Um,
That cost, that cost.
oh, definitely.
How much is that in the vicinity?
About $1,500.
Okay,
So.
cool.
Got a question. What points can you bring for prevention? How parents can talk to their children and just ways to enlighten them, educate.
Probably from a medical standpoint, they could do better. But a mom standpoint, hindsight is 20/20. I think the best thing we can do for preventative, even in the drug world, is stop cleaning up our kids' messes, even when they're little. If they're going to miss a bus, let them miss a bus. If they forget their lunch on a continual basis, not just an accidental, I would say the biggest thing is to quit. I can look back now, and his alarm clock would go off, and I'm downstairs yelling, screaming. Then I would get him out of bed. Then I would do everything for him. Then I would drive him to school because he missed the bus. And I just, it's something that you have to really take a look at. Now, I think young kids natural consequences are probably their best life lesson on how to be strong and to deal with responsibilities. So from a mom's point of view, I think the greatest preventative thing is to let them go through some things that they need to go through according to their actions. And these gentlemen can probably speak on the preventative ends from the medical standpoint.
From the children's standpoint, my kids were young enough to know that, you know, when I came back home from treatment and, you know, I was told that I shouldn't get into any detail with them, which I've told them as things have gone on, certain things. But the bottom line was I was going to be honest with them. I wasn't going to hold back. I was gone for a while, so I had to go into treatment. So I shared with them what happened and what I did, and all I could do was apologize to them. My youngest was 7, oldest was 12, 13, and she mentally was not in a good place. She hadn't done anything yet, as far as I know, and she would have told me. But, you know, I was just, I think I got to them maybe early enough. I think that's what we need to do as parents. Unfortunately, parents are dealing with their own issues. We're raising a generation of children. A lot of them are coming in, that's all they know. They've been dragged to the bars since they were very little, and they thought it was fun. They've been going to the dope houses. They've been left with family members, and they don't know. You know, I take care of a lot of individuals who have young kids, and you know, they tell them all sorts of things. Well, when they're out going to get to the dope dealers, or going away for a couple of days, you know, they don't tell them the truth. And I said, well, tell them the truth. Well, why would I want to do that? Because you're an addict, you're an alcoholic. It's not to make, you know, light of it, but maybe that'll help you understand what you are. But letting those kids know why you haven't seen them in 2-3 days until, instead of waiting until Job and Family Services comes in and takes them away from you. And then you're fighting to get them back, and that's the first time you're in the treatment, and that's the only reason you're there. You have to want it for yourself. So telling the children and the natural consequences, you know, being consistent. There's all sorts of factors in that, but the way the drugs have escalated is because they're more readily available, because they're more addicting. Anywhere from, I mean, beer and alcohol is still the number one chemical that is out there, that probably because it's the easiest to get and it's in most people's houses. And then the second is nicotine, marijuana, and then opioids. They all pretty much all start out as painkillers. Well, we probably half of us in here have been on painkillers. Me, I have an addicted brain. I have a plan in place. Fortunately, I haven't found a need or needed any medication. I haven't had any injuries, because that's how it starts, or surgical procedures. But if it is, I have a plan in attack, because if I have them in my hand, one's not enough. If I give them to somebody else and it's time for me to take it, I probably will take it like I'm supposed to, because I'm not focused on that. But that's a protocol, that's a plan that I've put into place because I was told to do that. I was told to do what I needed to do to stay clean and sober. Just to share, my business and my profession is not my program. I have a program of recovery. I have to separate the two. There's a lot of relapse. Relapse is part of the chronic disease of addiction and alcoholism. Just like any other disease, people relapse on diabetes. They're doing real good. They don't think they need their insulin, so they'll forget it, or they'll forget their second shot. So they can relapse. So the disease of addiction has relapses in it. That doesn't mean we don't take care of them. You know, if they have some clean time, that's positive. They use that clean time, but they relapse because of a person, place, and/or thing that had happened in their life, and they didn't have enough coping skills, and they didn't change their character flaws, which we all have and we all develop. Most of us, we all develop our coping skills when we're young. But if we start using when we're teenagers, our brain hasn't developed yet. Male's frontal cortex develops by the age of 25, female's about the age of 23. So if we're already starting to alter that neural circuitry with drugs and/or alcohol, or gambling, or sexual addiction, or whatever it is that takes us away from learning the coping skills, and so getting back to where do we start? Educating parents, did we, and to help their children, give the resources in school. These policemen and firemen, they're tired of getting calls all the time and seeing people die and can't bring them back. And it used to be one Narcan because it was just opiates, just heroin. Heroin metabolizes quickly. Fentanyl metabolizes a little slower. And fentanyl is typically what we're seeing now. And the carfentanil we can't detect because we don't have the technology yet or the technique quite yet to find it at the scene or in the hospitals. So that's all that's out there now. They're manufacturing fentanyl tablets that look just like OxyContins. So they take one pill OxyContin, which is in the street. It's not as much as it used to be. Here it's pure fentanyl. They take one pill, they crush it, snort it, inject it. They overdose because of respiratory depression. And then, of course, a lot of it is polysubstance abuse. It's mixing, and they all start at a young age. You know, if any of us have taken a drink or a cigarette or anything, we started when we were young. That's just how it is. Peer pressure, not knowing the long-term and the short-term consequences. So if we can better educate through programs like us, recovery, the 12-step program, Alcoholics Anonymous, Narcotics Anonymous, Cocaine's Anonymous, they're based on the 12-step. They are spiritually based. They do have the most success, 1 year sobriety. It's about a 55 to 56%, 1 year not relapsing. You would think, well, that's not good enough. Well, there are others. There are individual counseling, there's psychological counseling, there's multiple ways to do it. There's another organization called Smart Recovery. But they're not as successful, but it can still help get that person. We need to, my suggestion is, and where I'd like to see is, have these type of programs for kids, kids of alcoholics and kids of addiction, being in a room, groups on an ongoing basis like we do in recovery. How about putting them in a room to talk to other kids just like them? They're growing up. They may think they're the only one on the block that's dealing with a parent who's an addict. Do they come home from school and they're passed out? So they don't say anything because of the shame and guilt that they start to develop. So what does a kid do? Develop coping skills and mechanisms to shy away from that, and then they fall further away from their parents or grandparents who are raising kids now. You know, grandparents want to be grandparents. They don't want to be parents. And, you know, probably some of you are raising grandkids just because of situations. So there's so much, but it's not hopeless. An organization like Hope Over Heroin, it just started from a seed with people who had faith to coming together and just reaching out compassionately and helping and supporting our police and our firemen and our sheriff's departments who've been actively involved in having fundraisers and outreach programs like this in the communities at the senior centers and all that to get knowledge. And Lake Adamsburg early this year at Menor High School had a big outreach. And, you know, these are the things we need to educate because we can't fix it alone. And the other thing is the churches. Each church, you know, put down the denominations. There's churches are struggling with it, and the churches are trying to correct the problem in their own church, the gambling, the prostitution, the addiction, whatever it is. Networking all these churches together, you know, there could be a church up the road that's doing something very well, whatever denomination, and the other church up the road is needing their help, but they're not reaching out. So
Really coming together.
yeah.
And that's one of the things that drew us together. And we've said from the beginning is we all need to come together, whatever organization, denomination, whatever has elevated you up in your position. We all need to get down at the ground level, join arms together, no matter what you do or what part you play, and work together. Because what's worked in the past does not work now. And one of the other things I wanted to speak on as far as education, to answer the question in the back, is we can't start early enough, and we need to educate everyone.
All the way through, right?
Everyone. Little kids, parents, grandparents, police, fire. I'm a retired fireman from South Euclid, and I'm also their chaplain. And I hear from other departments, I hear the callousness of running on the same addict 15 times, and people saying, why are we doing this? Why are we doing this? It's a waste of resources. And that makes my hair stand up, and I share with them that is a human being. And you know, and we get into a debate, and it's always the same debate, and I say, that person there laying on the ground, you raise your hand to serve and protect, whether police, fire, or dispatcher, and that is one of those people. You don't select who you're going to help and not help, because that person could embrace recovery this time, the 18th time that you bring them back. So, but for busy departments, it is a problem. It is a problem.
I just want to say something, and maybe you can elaborate upon it. I know the state, through the Attorney General's office, has approved grants for local communities, and I think Lake County just got the grant to, after they're called to an overdose, and the overdose, well, however it turns out, I believe, that in accordance with the local police and or sheriff, paramedic, a social worker, and someone else will go back into that home and either discuss it with that individual, because nobody follows up on them. You bring them back from an opioid overdose, let's say. Opioid withdrawal is not going to kill you. You don't die from that. They die from alcohol and benzodiazepine and but the opioid addicts feel like they're going to die, and that's what keeps bringing them back. So they get Narcan, they wake up, and they are immediate withdrawal. Well, they want to, that increases the adrenaline, and they're, fight or flight. They're out of there, and so who follows up? So they go back and use again, and they're being called again. An hour, 2 hours later, and they're overdosed again because now their tolerance is low, and they use just a little bit to get rid of those symptoms. So I think that's a good idea, to bring in a community of individuals to come back into that home, to talk to that individual, say, we do care. What can we help you with? Or the family member that may have just lost a loved one. And I think that is going to start, or it did start October 1st.
There's grants. I mean, grants is evolving. I mean, we carry Narcan here at the college, which we got actually paid for by a grant, I believe. But there's actually grants for even counties for even, they'll give away. I mean, I think even Lake County Fight Against Heroin, didn't they give away, like 20 doses of Narcan for? I mean, I might be skewed on that number, but I know for a fact they gave them away.
I know that we have to go to a class to actually receive a Narcan kit. Our issue, which has been an issue, is if you're any type of faith-based organization, grants do have stipulations in what you can receive and what you can say and what we can't. The bottom line is we're not sticking Jesus down anybody's throat, but if somebody asks and that's their way to recover and we're not able to respond to that, then we have to thankfully decline the grant. And so that's where our funding sometimes has an issue, and hopefully that'll be looked at in the future. And as far as the education and prevention, like Dennis said, it's early as you can go, as early as you can. One of my favorite memories of Hope Over Heroin was ironically during the Memorial March, as I was weeping and crying, and a lady pulled down in her SUV and going down Fairgrounds Road, and her daughter was in the front seat. I would guess her daughter was probably about 11 or 12, and her mom stopped and looked, and I yelled, "Hey, little girl, don't be embarrassed," and I just smiled at her, and her mom yells, "No, we're going to sit here. She needs to know. She needs to see this." And that just really blessed my heart. I think sometimes we get nervous and we want to protect our children. They already know. Like my daughter, I'm like, don't, she's almost 16. I'm like, don't take candy from a stranger. Might not be a Smartie. Might be you just have to, and just come together. And the more people that embrace it and the more people that are talk about it, it's not going to seem that out of the park. And so the more we pull together, kids are going to hear. We're not afraid to talk about anything else, or they watch whatever they want on TV. So I think with everybody pulling together, everybody has a gift, everybody has a talent, everybody has a strength that they can bring to the table to help and to reach out. If you can give a hug, you can help. So.
What are your suggestions?
I would love to tell you. Let me tell you what I just went through as a mother who never sleeps. I nap. If you are a loved one of a family member, you nap. My son, just a week and a half ago, got a staph infection in his arm from a roofing incident, and it was bad. He actually was hospitalized for 7 days because they couldn't do it. So I went down to the emergency room, and the minute he went to the bathroom, I'm that panicking mom. Listen, he's a heroin addict. He's only been in recovery a few months. Please, anything you could do. And the nurse at this particular hospital was really good, and she did some things to try to help him go through, and I made sure everybody knew. When I went to go see him, they had him on a high dose of morphine and sent him home with Percocet, and now I haven't heard from him. So I don't know. If somebody has the answer, I would love that. I would love that when we are like this, help, don't do it, that we had some type of pull or some type of power. But my son is almost 27 years old. If they say, do you want morphine to an addict, that addict may. But that would be a good question maybe for even Dr. Zinni to answer, because he has a plan if he were to have an injury, because the knowledge that I'm getting, I love this format because we're all learning all the time, but I'm just finding out that anybody that deals with any type of heroin addiction, it takes 12 to 18 months for cognitive thinking to come back. So they don't even know how to make a good decision, and we're expecting them to make a good decision. And so it gets the waters get a little bit muddy, and that's why we need everybody, because there is going to be somebody possibly that has that answer, but maybe Dr. Zinni can help with that.
Just a little historically, a couple of things happened 20-some years ago or so when opiates were starting to be advertised and brought into our offices. And because I remember when OxyContin first came out in the early 1990s, and they promoted it as, the new wonder pain medication for acute pain. Also, you can also use it for chronic pain. Well, opiates are not necessarily to be made for chronic pain. Acute pain, trauma, surgical intervention. Because why? As you heal, you need less of the opioid. In an addicted brain, that you have to look for another way. But we didn't know about addiction. Addicted brain and opioids back in the 80s and 90s. It was alcohol and then crack cocaine, and because it's always been alcohol. And so at that point in time, when those drugs started coming, then the other thing happened. They made us, our certification from all the hospitals, all that, made the fifth vital sign. The fifth vital sign is pain. So if any of you have been in any doctor's office, emergency room, hospital, they ask you, are you at what level of pain? They show you the faces. Well, that's how the opioid epidemic occurred. We were told we had to ask that sign or we would be cited. We wouldn't be in compliance with the certification that certifies all these hospitals and freestanding clinics. So we asked that, and everyone's going to say they're a 10 when they're sitting there like this, and they're a 1. A 10, you can see that face. And so what happened? There was no limit on prescribing opioids, and this is the new drug. So we'll do the intermediate acting, immediate acting, and then the long acting opioids started coming out, like the OxyContin. They were only made for malignant pain, cancer pain, and significant arthritic pain. I found out that when I started writing those, which was minimal, it's amazing how I didn't write prescriptions for me, and I didn't get any legal issue from that standpoint, though. There was another way for us to get them back then. But I wouldn't write them for anybody other than they had true pain, and then they went through the proper protocols to find out where their pain was from. Cancer pain. People who have really bad pain, they're going to take it like they're supposed to because there is nothing else. And they'll take it, bad arthritic, the elderly population, it's okay to use in those circumstances. But what happened is that's how the addiction started working. And then, of course, OxyContin started getting in the street. It was never in the streets. Then methadone was only in methadone clinics, which is medically assisted treatment. It's used to help long-term opioid addicts and heroin addicts get off, at least stabilize them. And methadone was only in the methadone clinics. We have 2 of them in Cleveland. The only other ones are Youngstown and Erie, PA, and I think Canton has one still. But the bottom line is then it was okay for pain doctors, because then pain medicine started to become a specialty, which were anesthesiologists that converted over into pain management. And then they started to be able to write methadone. Well, methadone was only supposed to be given at the clinics where you go every day and drink the drink, and then you come back the next day and you do your program of recovery. So methadone started getting in the streets, and that's how it's just expanded. And then the other issue, unfortunately, doctors. We need to better educate them. We are doing better at it, but I cringe when I hear my colleagues or I hear about colleagues that are still writing too many opioids. There's other ways to manage pain, especially in the emergency room. I've worked in the emergency rooms and urgent cares. There's much better ways to manage the pain than opioids at that time. You know, we tell most addicts when you go in, you got to tell them that you're a recovering addict. Most don't want to do that because they know what they're going to get. That may not be their intent to go there. And now we've flipped it the other way. Everybody that comes in pain, even if it's real, and some of you may have experienced this, they're reluctant to give you anything for pain now because they think you're drug seeking. No, I'm really in pain. I just fell off a ladder, you know. But so we've gone to the other end, and now there's a rule, there's regulations that the governor signed a few years ago that we can give at least 3 days of pain medication in the emergency room. See, before, if we wrote it for 3 days or 5 days because we thought that would be enough, the patient would call, we'd get a call from our medical directors, hey, you didn't give them enough pain medication. It's because they didn't need it, but they're calling to complain. And so now we have something that backs us up. Also recently, in the last couple of months, for children and for adults, we have strict guidelines now from the state medical board and the state pharmacy board that we can only write narcotics or controlled substances for pain for 7 days, and that's it. If they need it longer, they have to come back in. There's a process they have to do. Well, if somebody just had surgery and they can't leave their home, I'm not so sure that is a good either, because you can only wait 7 days, but they can't leave their house. How are they going to get their next script? Well, they have to be seen. So, you know, but that's been signed, and we have to follow those guidelines. So they're trying to change it, and they reach out to the medical community to get some knowledge to help them on the state level and the local level to pass laws. But again, they're just, and one of the state representatives told me too at the Hope Over Heroin that he says we talk about almost every day at the state level and we throw a lot of money into it, and the statistics are still getting worse. It's still rising. It is.
Is
But
there
when
an alternative for her? Was it your nephew?
No, just a friend.
A friend? Like when he goes in for that second surgery, is it?
Yes, there
So
is.
your best advice is to let them know up
Let them
front
know up
that
front.
he is an addict, and maybe they can come up with a different pain management plan?
Yes.
That would be the best thing, is
Best
to make
thing.
sure they're upfront about it?
Yep. Tell the anesthesiologist who's ever doing that, and absolutely they can come up with a plan beforehand. That's what I tell people now that I take care of on an outpatient basis when they have to have surgeries, or I take care of women who are pregnant who are heroin addicts. I put them on medically assisted treatment. I put them on medication, which are opioid based, but at least they're not using heroin. They're stable. They're mentally clear. They're going through a program of intensive outpatient therapy, which is 3 days a week. They have individual counseling. So we plan. If you plan it, it works out pretty good, you know. It's just being honest. A lot of them just don't want to be honest. They don't know how to be honest. They're still shameful. They don't want to tell that they're an addict. You know, I don't necessarily like to tell on myself when I do it. It gets easier each time I do it, but there's a lot of shame and guilt. You know, it's not as bad for me because I've done it enough times, but there's still some there because of what I did and what I did to me and what I did to other people. So tell someone who's just clean in the first 6 months, who their brain hasn't, who's still altered from the chronic use, you know, and they got injured. You know, it's hard for them to go in and tell them that, hey, I'm an addict. The thing of it is when they do tell them they're an addict and they still give them the pain medicine irresponsibly, I have an issue with that. You know, that's not right. The doctor or provider, you know, I have to say just for myself, that happened to me. I had a minor surgery several years ago. I told the surgeon I didn't want anything. And out of, I think just because he's so used to doing it, he wrote me a script for 60 Percocets. The nurse gave it to me and discharged. I said, well, I don't need this. She goes, well, you got to take it now because I can't take the prescription back. He wrote it to give to you. So I took it and I hung on to it for a couple of days. Now, why would I hung on to that? I mean, that was a few years in recovery. So I talked to my sponsor, and he goes, what are you hanging on to that for? I said, I don't know. And then I ripped it up. It's just instinctive. I wasn't going to use it. But the bottom line is, why did I hang on to it? So even that thinking, somebody else didn't want it, probably just would have gotten rid of it. You know, I mean, there's a whole other, than I know the time frame, but again, to answer your question, there's ways. If you're upfront and honest, and you tell somebody, there can be a way to get through that surgical procedure or trauma or whatever it may be that you would require pain management. It can be done. So, thank you. To answer the first, I know there was a grant-funded study in Cleveland, Cuyahoga County, the Sheriff's Department, with Stella Maris, Lutheran Hospital, and Metro Health, that if someone came in an opioid overdose and was Narcan or brought back, the police would go back, or the sheriffs would go back in and talk to them. No legal issues at that point, but what they would do is they would offer them a bed right then and there into a facility, and that they would transport them there to that facility. And that started, I think, February of this year, and it was a 6-month pilot program. And initially it was working out pretty good, because they just want, all right, you brought me out of it, now you put me in withdrawal. I have to, I'm bolting, I'm out of here. But I really want help, you know? They get to the point, and you probably got to the point where, and I probably did too, I don't want to die, but I didn't know how to live anymore. I didn't have nothing, you know? But I had everything. But my brain told me I had nothing. I did all that stuff back in those days. You know, I gave up the drug, as you do, without the tools and without a program of recovery. So I think if that program works good and we start rolling that out, that's what we do. We help them after we get them out of their, you know, stupor that they're in, where they're dying. And my nephew died, and what kept him was his apartment, the house he was living in out in Madison, they didn't turn the heat on. So, you know, it was like 32 degrees that day. It was 10 degrees outside. And the ER doctor in Madison said the reason I kept him because he was hypothermic when he came in. He was on a ventilator. He celebrated his 40th birthday the other day. But he had a 5% chance of survival because he was on a ventilator, dialysis, and everything. And why did he use again? Because he's relapsed a few times, but as far as I know now, he's okay. You know, but why? Because, like you say, what happens a couple years later? You get complacent with society. Something else happens in our lives, a death, a divorce, a child goes away to college, and it's a major event, and you don't have any coping skills. So as a community and a network, I believe we can continue to bring that. If we, you know, AA is not for everybody, NA is not for everybody, you know, but what about churches opening them up their doors? Maybe they have a recovery program to reach out. We need to get this out in the community, because some things just aren't for everybody. You know, I was told to go to AA. You know, that made sense to me. Okay, that helped me, but I know that's not for everybody. So the resources, but it's giving them that hope that there's more to it. And like you say, getting back into your community and giving back to your local community is what you're doing. You may have helped somebody, you don't even know it. Right. But you keep doing it, and by keep doing it, you're helping somebody. And that's what we have to do, but that comes from education. And it doesn't take someone who has been through an addiction. But I believe everybody in this room knows someone or has a family member, or they themselves are recovering. Because it's just like cancer now. Everyone has somebody in their family who's got cancer.
And I do think a good model, though, is we really need to take a look at something, because I do think that we scratched the surface of something. This is all trial and error, trying to figure these questions out and what our concerns are. But the way the Safe House was set up for Hope Over Heroin, they would go through the medical tent, and Dr. Zinni is licensed to assess. So he looked at them. They had the nurses on staff doing their vitals while he assessed them, and they went straight into treatment. We had a transportation company that was on hand. So the minute this person has decided to get help, we took them directly to the treatment center that we had set something up with. For those that couldn't, they went back to a Safe House. They had a bed. They had somebody watching over them. They had food if they needed it. And then we had people that were resourceful making arrangements for them. Listen, they can barely hold on to a pair of pants and a set of keys. And so even me as a mother would take me weeks to find help for my son. And we're expecting somebody who's disoriented, who has pretty much no cognitive thinking skills, and probably doesn't have a phone. To pick up the phone, wait weeks, make arrangements, be organized, that's probably not going to happen. So to really look at where somebody overdoses, goes to the hospital, comes back, it's exactly what's being said. They're going into withdrawal, so they're going to use. But there were people that came from all over because they knew that we were going to help them. Because a lot of times when they go into detox, like we said earlier in the beginning, they'd have a 3 or 4 day detox and then they have to wait to get a doctor's appointment. And so I think things that are set in motion, that things are taken care of, that they can go from point A to point B. And we have some really great stories just in the making right now of people that just didn't know what to do and they're doing well in their treatment.
I wanted to share one of the first people that we got to work with, he saw it on social media from Cleveland. He lived in Cleveland. And he saw that, what he said was, he said, I can get help right now.
Right now.
So they jumped in the car and they flew to the Hope Over Heroin event, and we were able to love on him and get him right into treatment. But that's what he said. He said, this was, we talked with him extensively. And he said exactly what Dr. Zinni said, that about he doesn't know how to live. He doesn't want to die. He's overdosed many times, but he doesn't know how to live. And where, in my personal case with my son, when he finally chose treatment, it was a 3-week waiting list in Lake County. 3 weeks. And he came to me and said, Dad, I'll be dead. Mm-hmm. And so he went to Cleveland. So.
Yeah, there's some other barriers too. We need more detox units, and that's not really what we want to throw at it, but we truly do. There's a lot of people who are on Medicaid, Medicare, and or don't have insurance can't get into the detox units. Why? Because there's actually laws and regulations on the state level. There was a law passed over 40 years ago that put a limit on Medicaid beds in the state of Ohio and most states around the country, I believe. And that still sits there. It's been on a docket down in Columbus for 2-3 years. They have yet to bring it to committee and or to vote. And that's to open up those detox beds above the 16 limit for Medicaid individuals. So, there's hundreds of people that need help. It should just be open to anybody, but they put that limit there so detox beds wouldn't open up for alcoholics back in the 70s and 80s that Medicaid would pay for the state, so they put a limit on it. Well, now we have a crisis, and they keep that limit there. So Stella Maris has 16 beds, so they take the Medicaid and they have grant beds through the Cuyahoga County Adams Board. Laurelwood has some grant beds through the Lake County Adams Board, but they don't take Medicaid, although I believe they started taking CareSource last month now because there's such a need. Glen Bay can't take, they do through a grant, but because they have more than 16 beds, the laws, the way they are written, prevent them from opening up another detox unit just for Medicaid, another 16 beds. So, and there's more to it than that. But it's kind of like we have to stop that. We have to be able to open up these, because when they want it now. Mm-hmm. I mean, they get called. Recovery houses, we need more of them. Why? Because unfortunately the individual has burned all their bridges, or they have nobody left and they have nowhere else to go. And if you put them back into a place where it's out there like homeless, they're going to pick up, and they don't want to. They're scared. A lot of times they don't want to leave the houses. They don't want to leave the facilities. Why? Because they know where they're going back to. And they just don't have the tools yet. It takes a long time to get them back. It's a lifetime program. So I think if we start utilizing the network that Hope Over Heroin started, which is bringing, they had 40-some tents.
44 resource tents, and they got to know each other. So we're hoping in the future to put an event together, just bringing all the resources, because it was just incredible, from grief counseling to adoption agencies to even a company that has a gym, teaching addicts how to work through it through exercise and personal training and get your dopamine levels up. So we're really hoping. The community showed up. There was a lot of resources.
A lot of resources. And that's what we're hoping, to bring that all together and continue it, and having more, programs like we have, and during the winter once we're talking about doing it, and getting it out there, getting the word out there, and then just inviting people, not only those that are in need of help, but everybody needs help to help that hurting individual. And so, I mean, it's a big undertaking. I'm asking for your prayers, and anyone else, but we can't do it alone. And, you know, fortunately we have partnerships that are forming, because we don't want to see a life die. You know, no one, I didn't ask to be an addict. I didn't ask for it. I became one, and then I didn't know how to stop. And, you know, no one, but it was my responsibility to take care of me, though. I just needed to push. And yeah, everyone has a different bottom. Unfortunately, some are dying and they never reach that point. They've reached out. I've had a lot of my patients who have passed away that I've tried to help, and, you know, and you try to see things heading down the wrong way, and you try to get them back and on track, and, you know, they try. It's not that they don't want it, they just don't know how. And having that support, and so they reach out to whoever will listen to them. And it takes heart, it takes an understanding. It takes us, like we're up here now, giving information, and hopefully more will learn from what happened. Hope over here, and like you say, the resources and all those friendships that were forged, they want to do it again, because there's such a need. And of course, other issues now, children are growing up without their parents because they're overdosing, and that's so, you know, orphan children. It's on the rise in our country. And there's just not enough resources for them. So I'd like to stop that trend if we can. But anyway, that's, you know.
I want to thank the panel for coming out. You guys want to do
The Knowledge Exchange is a presentation of Lakeland Community College.